Hello, in this video I am going to show you soft tissue techniques that you can do mainly for the hamstring muscle group. If we look at the anatomy first, if we bend that knee, you can see already that there's a tendon that pops up quite nicely there. The more tendinous one is called the semitendinosus. The one adjacent to that, which you can't really see, is called the semimembranosus. And the one on the lateral side here, which is just here, if you just resist a little bit, okay, you can just see the tendon, and that's known as the bicep femoris. The bicep femoris comes onto the head of the fibula. The semitendinosus goes to what we call the pes anserinus, which is like the goose foot, and the semimembranosus goes to the posterior part of the tibia. They will flex the knee. Bicep femoris can assist in external rotation of the tibia, whereas the other two are known as the medial rotators of the tibia. They also assist in hip extension as well. Now, all the movements we do, the patient is involved. What that means is the patient is going to either actively contract the muscles, or I am going to passively lengthen the muscles. Okay, you'll understand what I mean as I go through this. I don't tend to use too much cream or oils. I tend to use a wax. It's just called a fascial release wax by Songbird, which is very good. So I've already placed wax on his leg. It's not shiny, okay, so I suggest you, it's like a sheen rather than a shine. So you apply enough to an area, especially if men have a lot of hair. He's okay, but sometimes if you have too much hair, you need a little bit more. Or maybe you might prefer to use a massage cream as such. So let's start. So we're going to start with the person in flexion. And what I'm going to do first of all is I'm going to use my fingers. I try not to use my thumbs. So I'm going to reinforce my fingers. We're going to start on the bicep femoris. So I'm going to use my fingers like this. Okay. And then what I want my patient to do is take a breath in. And as he breathes out, I'm asking him to slowly lower the leg down as I'm gliding through the muscles there. So he will go as far as he can, which means the foot is going to touch, but I might have gone maybe halfway or 3/4 of the way. So then I suggest he starts again, where the knee is bent, take a breath in, and then I apply from where I finished, and then I glide again here. Okay, coming up through that. It's hard to say how many times I do this because I tend to use other anatomical areas, as you'll see. So I'm going to come in. So sometimes when you come over here, you might find it easier to do the semis by rotating this way. Okay, so if I just come around this way, so he starts in flexion, take a breath in, use my fingers when you're ready. So I'm going to glide down like that. So nice and slow, so I'm gliding down. And he will go as far as he can, come back up. And then you repeat then where you finish, apply pressure. And then you lower, he lowers as you glide down through that. So there's nothing wrong with turning around to do that. The fingers work very well and you can focus on any area. But one of my favorites is using like a reinforced, well, when I say reinforced, I don't mean you gripping anything. You're almost bending the knuckles, so you're in this sort of position here and you lead in with the thumb. Okay, so some people would hold like a little piece of tissue. They find it a bit more comfortable. So I tend to place my hand like this, okay, but some people would bend, but I prefer to be like this. So he is starting in this position, and then again, when you're ready, off you go. So I'm gliding through, and he will go as far as he can. So this will be an active technique. Come back up, and again, off you go. So I'm gliding through that. So these are all active. Now, if I wanted to do a passive technique, it means I control all the movements, which if I'm honest, I prefer. Because what I can do, as you'll see now, is I can start in a bit more flexion, and then I can control how much he flexes. Let me do it. Okay, and if I want to, I can then ease him back off, where I can slacken the tissue, and then I can do the same technique again. So I can ease off, and I can go as far or as little as I prefer, and I can come back up. I can just glide through. So that gives me a bit more versatility. Also, the tissue is not eccentrically lengthening. If you just lower your leg down on your own, the muscle of the hamstring is working eccentrically to lengthen, whereas passively, it means it's not and it's more relaxed. Okay, so you might find it's not in a state of contracture when I do these techniques. What I also like to do is, if I asked him to resist, be careful, pull your heel towards your bum, activate the muscle for 10 seconds. So this would be known as a post-isometric relaxation of MET, which is a muscle energy technique. Relax. Now the muscle is now gone through a relaxation process. Take a breath, and as he breathes out, I can then lengthen passively. Okay, but now we've got the window of opportunity using an MET. Let's say, for instance, it's particularly tender in places, and as you're gliding through, it's a little sore. So instead of activating the muscle, you can say to the patient, push your leg away. Okay, now the tissue relaxes even more. Look, so now it becomes inhibited. So this would be known as a reciprocal inhibition technique. So if he just maintains, just push away, then I can glide my fingers if I want to. So it's an isometric contracture, or I can glide through in my knuckles from there. Okay, if I want to, I can say to him, you overcome me. So he's pushing, good. So he's extending his knee as I'm gliding, but it's still a RI technique. From there, we can do a lock. What that means is, let's say you found some adhesions within the tissue where my fingers are here. Then what you can do is go slightly above it and use your fingers and lock into the tissue. Ask your patient to flex there. Use your fingers to start with. Watch your nails if they're too long. Lock in. And then the patient can slowly lengthen the leg. Off you go. So you're locking like a soft tissue release sort of technique here, where you're locking in. Okay, there is a technique called active release technique. Yeah, but only qualified personnel who train under the ART banner can call themselves a ART practitioner. So be careful what you call this. Okay, you can lock in. If you want to, if you are using your thumbs, which most people would, I suggest you put one thumb over the other thumb and you lock in like this. Okay, but what I'm going to do is start there. I want to keep my thumbs, I want to keep my thumbs flat. Okay, I try not to do that where you bend your thumb over. So you one thumb, you lock, and then when you're ready, slowly straighten your leg. So then you lock in the tissues from there. Okay, and that one works quite well. The last one, I tend to use my forearm, and I've already put some wax on this arm here. You might find it easier to work from this side down, but just for demonstration, we start around, say, 90. Drop into that space from there. You can use a wide surface area. When you're ready, please, you can slowly straighten the leg, and you can use a little bit more pressure because the surface area is spread out as you are coming down from that. And you'll be surprised how much pressure you can use on that technique. But as I said, be careful, yeah, because all patients are different. And as you lower in, you can work through that. If you prefer to turn around and come this way, where you drop down, off you go, and you can do that. Okay, I can control it with my arm if I want to. I can start here, and I can control. So it's almost like an active passive in some way. So he's lowering, but I'm almost controlling him. So I'm gliding down through that. From the forearm, to change it, you just literally just bend the elbow, and you can focus a bit more towards the olecranon here. So what that means is, instead of using a wider surface area, from there I can just change the angle. Be careful on the point of the elbow from here, okay, from there, and I can then slowly, when you're ready, be careful on pressure. I can just glide through those tissues along there and relax. So we've done a few variations using the reinforced fingers, using the knuckle, if you like, leading with the thumb, and using the forearm, yeah, and pivoting towards the elbow. We did a variation of an active technique, a passive technique, and we also did an MET, PIR, and RI using a resisted motion. I hope you find the video of interest, and thanks for watching.